Thanks for joining us on this Saturday morning. Asthma is a serious condition which affects millions of Americans. It's currently one of the leading chronic diseases in children, but you may not know that cats can have asthma too. And our pet vet, Dr. David Visser, joins us here in studio to help us learn more about this syndrome. Good morning, doctor. Good to see you.
Yeah, you know, that panting of dogs is an excitement thing, but if your cat is panting, you better wonder what's going on. They certainly can be warm, but they're not usually going to be panting with excitement, and that is the reason why people need to be tuned into this strange breathing pattern. Cats will express a lot of sudden difficulty breathing, a lot of labor to the breathing. If you watch your cat, you know what the regular breathing pattern is, but when you see that it's becoming more labored, or when a cat is having difficulty moving around because of all of this fast breathing and open mouth breathing, something different is going on, and that's why we're talking about it.
Okay, so how would you go about diagnosing asthma in a cat?
Well, it's tricky. Sometimes the signs are enough to trigger somebody that it is not normal what's going on, but there are certain tests that we do. On examination, we do a thorough evaluation of a cat. We check the membranes to see whether we've got some paleness or whether it's the normal pink color, but we also listen to the heart and lungs because that's going to be the area of focus. If we can't identify based on what we hear, we need to do some tests, and x-rays of the chest are a way in which we can evaluate size of the heart, shape of the lungs, the density of the lungs. See, if there's fluid buildup or inflammation, those lungs are going to look different than a normal set of lungs. But sometimes also we need to collect a fluid analysis from the lungs. Now that may sound invasive, but sometimes it can just be from the windpipe, and it's certainly under sedation. But this is going to be an interesting thing when your veterinarian suggests a heartworm test. You know, in actuality, heartworm in cats, first of all, does occur, and second of all, the most common sign and symptom is this type of difficulty in breathing. So before we had heartworm tests for cats, we diagnosed a lot of cats with asthma when really they had heartworm. So this is going to be an important differentiation that your veterinarian is going to go through.
And I guess if you've ruled everything out, a medication therapy might actually say, yeah, that's exactly what it is.
Sometimes that's exactly how we diagnose it, by using a medicine that is designed to help with inflammatory conditions, and safe, of course. And we want to make sure that we then see the response, and we can indirectly presume asthma or an inflammatory condition if that's the case.
Okay, so can you be on these treatments for a long time? I think a lot of people, I know humans don't want to be on pills for a lot, and then you probably don't want that to be the same for your cat.
Yeah, that's true. And so the medications that we might choose to use, there's different levels of them. There might be medicines in the cortisone family to reduce the inflammation. It might be medications that help open the airways. But remember that this is probably a genetically programmed condition, and as long as the genetics are there, then the management tool has to be there. So this doesn't generally go away. If it's possible to avoid what a cat is being bothered by, avoiding it certainly is great, but that's not typically the case with asthma. When they have it, they're not tolerating something in an environment, and they do need to be on medications to help manage that.
I know my daughter needed like an inhaler for sports, and it was like for an asthma condition.
Yes.
Can cats use that as well?
You know, cats are real sensitive to that hiss sound that those inhalers make.
Yeah, that would be a problem, I would think.
Yeah, but they benefit from the medication itself.
Sure.
So in fact, while there may be common inhalers used for people, and this can be prescribed for cats, as you can imagine, they're not going to put their mouth on it. They don't like the sound of the hiss. But there's been an invention of something called AeroCat, which is a chamber that can allow...
Here, hold that up just a little higher.
Yeah. It can allow the medication to be actuated into the chamber and then brought to the cat's face to be able to breathe this in. Now, is it an easy thing for all cats to accept? No, but with gentle training and with something good that follows the challenging process, then cats accept this very well. So just a normal puff into the chamber, but then cats will just breathe without having to hear that hiss sound, and they feel better real quickly after this. So if it's not managed by this type of approach, there are other medications, like I said, that can do that. But this is a very unique thing, because instead of treating the whole body, we're actually topically treating the respiratory tract. Always better to treat locally rather than whole body.
I bet. And I'm picturing my ornery cat and what I would look like after I tried to do that, because he would claw me apart. But yeah, but you would have, like you said, gentle training.
Yes.
Maybe you could get this done.
Absolutely. There's optimism on the other side of this very frustrating diagnosis. I think the most important summary point is that this can be a very serious condition. We need people to be aware that things can change rapidly. It's not not the only thing that causes respiratory distress. And so some of these tests are also to look into things like fluid in the chest or heart disease, a lot of things that can look the same. So getting attention is important. But there are some things that people can do at home, using a low dust type litter, using home filters to make sure that the dust is cleared in the air, not using aerosols, and specifically around the cat's living area. And you know, those powders that we put in the carpet sometimes, those deodorizers might be great for having a clean home, a deodorized home, but those powders can also be irritating. So we want to make sure that cats have good accommodations if they're having this diagnosis and needing to live with this condition.
When do you need to consider emergency care for this?
Well, I think if there is some difficulty breathing, and if you look at the gums and there's any change from its normal pink color, this cat is not only having difficulty breathing, but is also in a crisis situation. It's always okay to go to the veterinarian, go to the emergency center, and have it not be serious, but the opposite would be devastating, to not go when you really need to.
Good advice. Thank you. I always learn so much. Thank you. Oh, hello. Hi. We're back again. All right. If you want to contact Dr. David Visser, you can reach him at the Center for Animal Health by calling 888-PETS-VETS. And you can always shoot him an email, michianaPetVet@comcast.net. Dr. Visser, happy holidays if I don't get to see you again, but my goodness, it's always good to see you on a Saturday morning. We'll be right back.